I do not believe that since saying right or left tumor is so easy, we have to give up from acquiring more information about molecular mechanisms underlying these differences. We all well know that there are some important differences in terms of molecular characteristics between right and left-sided colorectal tumors. And we had some suggestions from a previous series and previous trial saying that the efficacy of targeted agents could be different between right and left-sided tumors. We know that while in left-sided tumors there is a high degree of EGFR dependency, so that the choice of an anti-EGFR may be preferred at least when the doublet of chemotherapies chosen as a chemo backbone. On the other side, in right-sided tumors, there are many different molecular markers responsible for resistance to anti-EGFRs. That's why in a right-sided tumor, the addition of anti-EGFR to chemotherapy does not provide a significant benefit over chemotherapy plus bevacizumab. This is not a detrimental effect, but the addition of benefit, the advantage from the choice of the anti-EGFR is very, very small. Moreover, data are consistent in identifying a poor prognosis for right-sided tumors, both if RAS wild type or RAS and BRAF wild type. These results may suggest to adopt a more intensive first-line strategies in right-sided tumors, including an intensified chemotherapy such as the triplet plus the anti-angiogenic bevacizumab. I do not believe that we have to take this information of right versus left as a black or white decision. I think that from tomorrow on in my clinic I will regard that primary tumor location as one factor that may potentially influence the choice of the first-line treatment as well as other kind of variables. We still need to do a lot of effort to understand biological mechanisms and molecular mechanisms underlying these differences in the efficacy of targeted agents between right and left-sided tumors. There are some RAS and BRAF wild-type patients with the right-sided tumors that may derive benefit from anti-EGFRs. We need to identify these patients. At the same time, those RAS and BRAF wild-type patients with the left-sided tumor who do not derive benefit from anti-EGFR, we still need to understand why.